I know this is me being old man rages at cloud and stuff, but there's something gross about a hypnotherapy, hypnosis thing being right next to a pathology sign outside of a medical centre. Like that, that's pseudoscience. That's not medicine. Why is it in the same place? That's like, it's gross. And you can miss me in the comments with your, oh, this blah blah, PTS blah blah blah, because whatever. Literally all hypnosis does is give you something to latch onto to legitimise your inadequacy, right? Like, that's all it does. All it does. You're a hop, skip and a jump away from leeching yourself for unbalanced humours. It's nonsense.
Really? Explain hypnotic surgery or dentistry, or the overwhelming evidence for many applications for hypnosis from the Mayo Clinic and Cleveland Clinic, as well as the American Medical Association. This is what happens on an opinion-based video without actually knowing the subject you're speaking against. Ironically, this is a pseudo-intellectual argument because it's not based on anything other than opinion.
Hey ha 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 ha, you're so dumb. This is what happens when Americans comment on medicine, hey ha ha ha. Dentistry has nothing to do with hypnosis, you wackadoo, hey ha ha ha. Go and comment on someone else's channel, you loon. Pinned your comment because you're so stupid everyone should see it, hey ha ha.
There is literally video on YouTube of someone having dental surgery without anesthesia while in a hypnotic state, not feeling any pain. And hypnosis has been proven in many areas as well. Imagine not knowing what hypnosis is or how it works, while ironically calling someone who's an expert in hypnosis stupid. Ha 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 ha, now pin this comment.
Hey ha 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 ha, you just doubled down on your stupidity. I love it. You can't even help yourself, you're so dumb, hey ha ha. Just saying it's been proven in many areas doesn't make it so you whack job, hey ha ha.
Okay, so you won't mind if I use your video for my own, so I can fully expose myself as a whack job on video. If you're right, then you should have no problem with me showing how stupid I am, right?
My video is literally in the public domain, you fool. I don't care what you do with it, ha ha ha. You're either deliberately deceiving people or you've been deceived yourself. I genuinely feel sorry for you, mate, hey ha ha.
Okay, let's get it.
Signs that someone might be a pseudo-intellectual. Using unnecessarily complex language.
Legitimise your inadequacy.
Pseudo-intellectuals tend to be overconfident in their knowledge, even when they lack expertise in a particular area.
That's pseudoscience. That's not medicine.
They might speak authoritatively about subjects they know little about.
That's all it does. All it does. You're a hop, skip and a jump away from leeching yourself for unbalanced humours.
And may become defensive or dismissive when challenged.
This is what happens when Americans comment on medicine, hey ha ha.
They may also be quick to label anyone who disagrees with them as unintelligent or uninformed.
Hey ha 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 ha, you're so dumb.
They may also engage in confirmation bias, only seeking out information that supports their preconceived beliefs.
I am Hypnotist. And what's the purpose of this video? Well, you may think it's about the guy at the beginning and his inaccurate views on hypnosis. But this isn't just about correcting misconceptions. It's about tackling a much larger issue that plagues many fields. And that's the pseudo-intellectual. You see, there are those out there that love to parade their supposed expertise without the substance to back it up. These pseudo-intellectuals thrive on appearing knowledgeable without actually possessing the depth and understanding they claim to have. They'll argue strongly for their opinions, but when put to the test, they'll crumble when asked for solid facts to support their claims. Now, one of my favorite claims of these pseudo-intellectuals is that hypnosis is pseudoscience. Well, let's set the record straight. While hypnosis may have started out shaky, and it definitely was a pseudoscience, but in the recent years and decades, we've seen a surge in scientific evidence supporting its effectiveness and validity. Now, pseudoscience lacks rigorous peer-reviewed study and testing, relies on faith and myth, and doesn't produce consistent results. While science thrives on evidence, undergoes rigorous testing and peer review, produces repeatable, reliable, and evolving results. In this video, I'm diving deep into the scientific evidence that supports hypnosis, and we'll explore a case study, share research findings, and provide you with the tools to verify the facts for yourself. So if you've ever doubted the legitimacy of hypnosis or hypnotherapy, get ready to have your misconceptions shattered. This isn't just a video, it's a journey through the undeniable science behind hypnosis. So let's get started here in 1997 with Pierre Rainville, who was a prominent researcher in the field of cognitive neuroscience and pain perception. Rainville, along with his colleagues, conducted several studies exploring the neural mechanisms underlying pain perception and the modulation of pain through techniques such as hypnosis. This study is one of the well-known works in the field, and it found that highly hypnotizable individuals showed reduced activity in the dorsal anterior cingulate cortex, an area involving pain perception when given suggestions for pain relief during hypnosis. This was also the findings of Lynn Milling, a clinical psychologist and professor at the University of Hartford, located in Connecticut. He is known for his research focusing on hypnosis, pain management, and clinical psychology spanning the late 90s to the early 2000s. Milling conducted numerous studies exploring the effectiveness of hypnosis in reducing pain, particularly in post-surgical settings and during labor and childbirth. His work has contributed significantly to the understanding of hypnosis as a therapeutic method for pain relief and its clinical uses. These were also the findings of Dr. John Oakley and Dr. Peter Halligan, who studied at various research institutions, conducted the same research in 2013 with the same results. There's Trevor Thompson, Faculty of Education and Health at the University of Greenwich, London, England in 2019, and was showcased by Ernil Hansen in that same year. And there's the current researcher, Dr. David Spiegel of Stanford University School of Medicine, and the list goes on and on and on. Now, the way they study the effects of hypnosis on pain is where they apply different stimulus like pressure, heat, and shocks delivered through electrodes on the skin of over 1,000 subjects in those randomized controlled trials, and it's found that highly hypnotizable people's brain data showed no change, as well as heart rate and pulse, which stayed consistent throughout the session. And average hypnotizable people showed very little response to the same stimulus. And as I said before, hypnosis has been proven in many areas such as weight loss, as shown in studies by Dr. Irving Kirsch of Harvard Medical School. And he found that compared to people undergoing cognitive behavioral therapy for weight loss, those who underwent cognitive behavioral therapy coupled with hypnosis tended to lose significantly more weight and maintain that weight loss during the follow-up period. And there's evidence to support hypnosis alone for weight loss, such as with the Montgomery Researchers Group and the previously mentioned researchers for pain management. Hypnotherapy has also been proven in smoking cessation as well. A systematic review of meta-analysis published in the Journal of Smoking Cessation back in 2021 looked at 21 studies involving over 3,000 participants. The analysis found that hypnotherapy was associated with significantly higher quit rates compared to no treatment or alternative smoking cessation interventions. The authors concluded that hypnosis could be considered an effective method for smoking cessation. This was also shown in a randomized controlled trial published in the International Journal of Clinical and Experimental Hypnosis back in 2008, which compared hypnotherapy to behavioral counseling for smoking cessation. The study found that over a 6-month period follow-up, that the hypnotherapy group had a higher abstinence rate at around 51% as compared to the behavioral counseling group, which stopped smoking at around 16%. Another randomized controlled trial published in the Journal of Counseling and Clinical Psychology back in 1992 compared hypnotherapy to a method called rapid smoking and the combination of the two. The study found that all 3 treatments were effective, with the abstinence rate at around 51% for hypnotherapy, 42% for rapid smoking, and 53% for the combined treatment at the 6-month follow-up. There was also a study by the Cochrane Systematic Review published back in 2010, which analyzed data from over 12 studies with over 1,800 participants, which found that hypnotherapy may be more effective than other interventions for smoking cessation. However, the authors did note that the quality of evidence was limited due to the methods used in the study. Now, while the evidence is not exactly conclusive, these studies have shown success and has been proven in many cases, which shows that hypnotherapy can potentially be an effective method for helping people quit smoking, especially when combined with other behavioral interventions and counseling. And finally, mental health. As hypnosis alone isn't recommended for serious mental health conditions, if used along with psychotherapy and with a qualified professional hypnotherapist, many who suffer from mental health issues will see significant improvement. Hypnosis has been increasingly recognized as a valuable complementary therapy in treating various mental health conditions, and while more research is still needed, there is growing evidence from case studies, clinical trials, and reviews by professional organizations supporting its effectiveness. In 2015, Dr. Jose R. Maldonado and Dr. David Spiegel reported a remarkable case of successfully treating a patient with dissociative identity disorder, or DID, using hypnosis and ego state therapy. Through hypnotic interventions, the patient's dissociated identities were able to integrate, leading to significant improvement. In 2008, a case series published by Dr. G. Abramovitz, a clinical psychologist who was the director of psychology training at a veterans hospital, demonstrated the use of hypnotic technique like ego strengthening and age regression in treating 4 patients with PTSD. After the hypnotherapy sessions, all 4 patients experienced substantial reduction in their trauma-related symptoms. In 1981, published in the Journal of Abnormal Psychology, Charles B. Shrignar described treating a 31-year-old man who had suffered from an intense, incapacitating fear of snakes since childhood. The treatment involved the use of hypnosis combined with systematic desensitization. Under hypnosis, the patient was able to vividly imagine scenes involving snakes without experiencing the usual intense anxiety. Shrignar then had the patient work through a hierarchy of snake-related situations, using hypnotic relaxation and vivid visualization at each step. After just a single 2-hour treatment session using this combined hypnosis and desensitization approach, the patient was able to hold and touch a live snake without fear, something he had been terrified to even think about previously. And at the 6-month and 1-year follow-up, the patient reported continuing to be free of his previously debilitating snake phobia in real-life situations. This influential early case study provided compelling evidence for the potential efficacy of using hypnosis as an add-on to exposure-based treatments for phobias and other anxiety disorders. Charles B. Shrignar was a pioneer in exploring the clinical applications of hypnosis through therapy cases published in the 1970s and 80s. And since then, the fast phobia cure has been successfully used by numerous hypnotherapy and NLP practitioners throughout the years and decades, and has been refined and used to treat and even eliminate phobias in as little as 15 minutes. So there you have it. Names, dates, publications, institutions, and case studies, all pointing to the scientific efficacy of hypnosis. So if there's ever an encounter with a pseudo-intellectual, then you can use this video to show them that yes, hypnosis is fully backed by science and the evidence is still growing. Now, I know I had to trim it down in a few areas because if I talked about and gave all the names and case studies and publications, this video would have been much longer than I wanted to make it. So I had to cut it down in a few places. But trust, there's a lot more evidence and research than what I named here, so that you can go back if you want and look these names up yourself and see if I'm wrong on any of the things that I talk about. As for the guy at the beginning of the video, if he does happen to see this, do you still have the same opinion now? Are you going to admit that you were 100% wrong in what you were saying, and that your original opinion on hypnosis was completely your own and it wasn't fact, no matter how confidently you stated it? Sometimes it takes a man to admit when he was wrong. Calling me stupid doesn't get rid of the fact that what I spoke was truth. Maybe next time you should look at the name of the person commenting before you decide to call an expert on hypnosis. dumb, especially without at least doing the research for yourself, because it makes you look highly immature. Instead of countering what I said with any type of information or facts, you just resorted to insults, which mean you had none. You wanted to make it look like what you were saying was true. Understand this. I've probably read more books on hypnosis than you've read books, and this is not a shot at your intelligence. I'm just talking about the number of books, both print and audiobooks, that I have on hypnosis. It's a very expansive library, and I've been practicing the skill at a high level since 2010. So I'm pretty well educated on the subject, and still to this day I continue to do my research and find new information and new interesting facts about hypnosis all the time. I continue to attend seminars and trainings. You may see this as some cute VR avatar, but this is not the full me. This is just an aspect of me, a persona that I present online. In real life, I'm fully engaged and fully immersed in hypnosis pretty much 24/7, and anybody who knows me can vouch for that. So when I speak on the subject, I'm not just speaking from opinion or from things that I haven't well researched and well looked up and practiced. As both a hypnotist and subject of hypnosis, this is something that I pretty much live and breathe. And no one has deceived me. All these findings that I presented came from people who are much smarter than you and me, much smarter. From your initial response, it makes you seem very narcissistic and insecure. If I'm correct about that, there's a few ways that you'll probably respond to this video. You'll probably resort to more insults, which is the most predictable and most likely outcome. Or you'll just stay silent and not respond at all, which I can respect. But anyway, I hope that you have an amazing day, and I hope your channel continues to do well, and hopefully in the future you won't be so quick to go to insults whenever your views or anything gets challenged slightly. Oh, for the rest of you guys, I got more videos coming. I'm still practicing hypnosis professionally. It keeps me quite busy, but I am still working on the channel. I haven't abandoned the channel. I have some more vids coming up really soon, even vids I've already started working on. There is one where I'm tackling questions like hypnosis versus religion, which is going to be pretty controversial. I'm trying to be as nice as possible. I promise not to beat up on religion, because I do respect people's religions. I've been working on this video for quite a while, just been so busy. I couldn't quite edit and do all the things I needed to do to get this out. But I've been telling in my hypnosis group that I teach on Tuesdays that I was going to put this video out, as well as my friend and my girlfriend who goes by Pineapple Swag on VR chat, that I was going to put this video out. And they probably thought it would never get released, but I'm happy that I finally have been able to record and upload this video, and I hope you guys enjoy it, and I hope you'll come back for some future videos. I like this format. I'm using different video editing tools and taking advantage of some of the technologies that exist, and I really enjoy creating this. So hopefully you guys will continue to stick with me, and as long as you guys keep supporting, I will continue to put up videos, and I got some really good stuff coming in the future. And I hope you guys enjoy the rest of your day, and I'll see you around. I am Hypnotist. Peace.